So you are called for a 26-year-old male found by family in a house unconscious.
All right, so immediately I'm thinking environment, access and egress, if I'm able to get my stretcher there and back without need a scoop or a stair chair. I'm thinking about pets and hoarding, if that's going to block me from getting to the patient. Mechanism of injury, unconsciousness, my immediate directives are probably opioid overdose and some form of arrest. I'm going to go with CAB because they're unconscious. Number of casualties is 1. Allied agencies, I might do lift assist from fire, depending on how heavy, and I might do ACP if it is an arrest, and I'm going to go with airborne PPE, gown, gloves, N95, goggles, mask. I approach the scene. Is the patient as found?
Yep.
All right, they are supine. Do I notice them tracking, interacting at all?
No.
Okay. Do I see obvious chest rise and fall?
Yes.
Okay. Do I hear any advantageous noises from here?
Yeah, you hear a bit of snoring.
It is snoring. Okay. Do I notice any blood, modeling pallor, cyanosis?
He's a little pale.
It's a little pale. All right. I'm going to approach and say, "Hi, hey, my name's Teo. I'm a student paramedic. Can you hear me?" Any response?
Nope.
All right. Because they're found by their family, I'm going to ask the family as a bystander. What is their name and age?
His name is John. He's 26 years old.
Okay, and do you know if John is feeling sick? Any nausea, flu symptoms, diarrhea, anything like that?
Nope, we were just out for a walk with the family. He's been pretty good recently.
Okay, and did he hit his head, neck, or back at all?
No, he sat down on a bench and then kind of just slumped over.
Okay. I'm going to maintain my current PPE. I'm going to get a little bit closer now that I know it's friend negative. Let's say, "Hey, my name's Teo. John, can you hear me? John?" I do a trap squeeze. He's a little bit alert.
Yeah, he responds to the trap squeeze. He also makes a bit of a moaning, like sound.
John, are you responding?
No.
Okay, that is the. All right, so I'm going to move on with my CAB. He's not responding, so he's alert and oriented times 0. I'm going to go for carotid and radial. I'm looking for the approximate rate, rhythm, and strength.
His pulse is weak, normal, and slow.
Weak, normal, and slow.
Like a regular rhythm.
Okay. I'm going to take note of the temperature, if he's diaphoretic and color.
He's warm and a little diaphoretic.
Diaphoretic and still a little pale?
Yep.
Alright, I'm going to check the cap refill.
Under 2.
Alright, I'm going to visualize the abdomen for any distensions, masses, or discolorations.
You don't see anything.
Alright, I'm going to palpate the 4 quadrants. I'm looking for any guarding, rigidity, or grimacing on the face.
You don't notice anything.
I'm going to then take off the shoes.
What are you doing?
Roll up. I'm just gonna feel
What are you doing?
some peripheral edema here, John. Don't worry about it.
Am I losing a leg?
You'll be fine, buddy. Alright, I'm feeling for any peripheral edema.
There isn't any now.
There isn't any. Okay, John. Alright. I'm going to then move into airway. John, can I get you to open your mouth? Hamburger? Okay, buddy. I'm checking for any obstruction, swelling, blood, broken teeth, anything like that.
Nope, nothing.
Alright, John, can you give me a big smile?
Yeah. It's okay, go
I'm
upload
looking for any
yourself.
facial droop or slurred speech.
He isn't really talking, but it's not slurred when he tries to make sounds. No
Alright.
facial droopage either.
Checking that the trachea is midline and I'm feeling it.
Yep.
Alright. Feeling for any subcutaneous emphysema?
There isn't any.
Come on, I'm dying.
You'll be alright, John. We'll get you through. Alright. Going to state real quick. I feel the 4 quadrants. Deep breath, John.
Clear. 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 All clear. A little bit of snoring still.
A little bit of snoring still.
Yeah.
Alright, I'm gonna feel for bilateral entry.
Yep, it's equal, bilateral.
Are you harassing the police?
No. All right, I'm looking for approximate rate, rhythm, and effort of the breath.
Approximate rate is to 12 breaths per minute. Effort is relaxed, and rhythm is normal.
Awesome. Okay. John, is there any way I can get you to sit up a little bit? Is that something you can help me out with?
I'm hungry.
You're hungry? All right, here, John. I'll help you up, sit you up a little bit, get you to lean back against here, and then look over there. If you can, get that 45. I'm looking for any JVD. No JVD?
Nope.
Is that the angle on this guy?
No GPD.
All right, John. Okay, does this help with the snoring? It's no longer.
Yeah, he's not snoring anymore.
Okay. Now for my report. I had a 26-year-old male named John. His parents called because he fell unconscious. After on a walk. He had originally a GCS of 8, and then it quickly improved. He was looking at me and tracking, so that's eyes 4. He was able to follow commands, so that's motor 6. And then he was still speaking incomprehensibly, so that was a verbal 3. Abnormal findings, his heart rate was weak, and his breathing improved, and there was snoring upon entry. I think this would be a stay and play.
Awesome.